Doctors, what's the most bizarre diagnosis a patient nailed before you did? So, I'm a doctor, and there's one story that always blows my mind. A few years ago, a patient came in, a middle-aged man who had been struggling with constant fatigue, headaches, and some weird pains in his joints. He had seen a couple of specialists before me, but no one could figure out what was going on. He sat down, clearly frustrated, and said something that took me by surprise. He looked at me and said, "I think I have Lyme disease. I've been researching it, and all my symptoms point to that." I'll admit, I was skeptical. Lyme disease wasn't really a common diagnosis where I was practicing, and he wasn't showing the usual signs like the signature bullseye rash. But instead of brushing him off, I decided to dig deeper. We ran a series of tests, including the Lyme disease test, just to rule it out. And you know what? He was right. His test came back positive. Turns out, he had been bitten by a tick a few months prior while hiking, and he had the early stages of Lyme disease. The specialist had missed it, and his internet research actually led him to the correct answer. I was amazed. He had nailed his diagnosis before I even considered it. It was a good reminder that sometimes patients really know their bodies best. That day, I learned not to overlook even the most unexpected possibilities.